Hi, Emily. We'll be beginning at 8.
Sounds like a plan. Thanks, Carrie.
You're welcome.
Good morning. Calling to order the Board of Health meeting for the town of Shrewsbury. Today is June 4th, 8 o'clock. We have minutes of the last meeting of May 21st. The minutes were distributed electronically. Are there any amendments? Hearing none, I'll entertain a motion to accept them as written. Ms. Rosachi?
Motion to accept.
All right. Abraham seconds it. Ms. Walker?
A vote aye.
Okay. Ms. Rosachi?
Aye.
Abraham votes aye. The minutes are unanimously approved. Mr. Truman, please join us. We want to talk about a public hearing regarding the local upgrade approvals for the on-site disposal system at 835 Main Street. Good morning.
Good morning, Andy Truman, town engineer. So we are in the process of renovating 835 Main Street, which is down by Dean Park. It became apparent a few months ago that there's actually no sewer there. It's on a cesspool, so they had the Title V done, didn't pass the Title V, no big surprise. So we've got a septic system in there, but it is going to really require some local upgrades to setbacks to the property line. So I think the plan's been in. I think it's been approved by Phil. So we just need to set up a date to get the variances approved, or the local upgrades approved, I guess, by this board.
Great. So, first of all, questions for Mr. Truman?
I don't have any questions.
Ms. Walker?
No questions on my end.
Great. Is that okay if we set it up to be in conjunction with our next Board of Health meeting, which we think will be July 20th?
I believe so. Joe Sexton's here from, I think they're looking for this. This is not holding up the C of O, but
Okay.
obviously it needs to be
So
online.
proposed next board meeting date is July 23rd. Okay. So we can start with the public hearing first and then
That's fine
proceed
with
to the
me.
board meeting. Excellent. So that would be 8 a.m. on July 23rd.
Great.
Can you make a motion, please, to?
Yes. So I'll make a motion to propose a public hearing regarding the local upgrade approval of the on-site disposal system at 835 Main Street. The hearing to be held on July 23rd, 2025 at 8 a.m.
I second that motion.
Great. So we'll take a vote. Ms. Rosachi?
Aye.
Ms. Walker?
Vote aye.
Okay. Abraham votes aye. It's unanimously approved. Date is-
Very much. We'll see you.
Thank you very much.
Thank you
Thank
very
you.
much.
Bet.
Hi, Joe.
Hi, thank you.
Have a great day.
You as well.
We'll move to the communicable disease update. Ms. Houghton?
Thank you. Good morning to the chair, to the board. I'm Amelia Houghton, Chief Public Health Nurse for the City of Worcester and the Alliance Towns. I have the nursing report, and this report is for May 2025. So we'll start with the case counts. The influenza cases have gone down considerably. There were only 2 reported in May compared to 17 reported in April. The coronavirus cases are pretty stable. There were 8 reported in April and 10 reported in May. It's been fluctuating by 1 or 2, so that's about the same. We had 1 norovirus and 1 salmonella case. No measles at this time. That's it for the common confirmed cases. And just want to go over a few public health updates. So there is a COVID-19 update. So there's a new COVID strain. It's called NB 1.8.1. It's an Omicron variant. And this new strain is surging currently in China. It's been detected by the U.S. Centers for Disease Control and Prevention's airport screening program in California, Washington, Virginia, and the New York City area. So that's something that we will probably hear more about in the upcoming weeks. In terms of the vaccine, according to Robert F. Kennedy Jr., the COVID vaccine will no longer be recommended for healthy children and pregnant women, citing that over 95% of the U.S. has population immunity. What they're doing is recommending it. The FDA will only recommend COVID-19 vaccines for adults that are 65 years and older and those who are 6 months to 64 years with at least one risk factor. So, and I have a link on the report if anybody wants any more information on the recommendations. Okay, so I'm going to move on to measles. As of, and this is according to the CDC, as of May 29, 2025, we are at 1,088 confirmed measles cases in the U.S., reported by 31 jurisdictions, still encompassing a total of 14 outbreaks, and still, so far, not including Massachusetts. And the number of deaths has not changed. There are still 3 confirmed deaths from measles. They've updated the travel health precautions for measles, so cases are rising in many countries around the world. All international travelers should be fully vaccinated against measles with the measles, mumps, rubella, MMR vaccine. And this is according to the CDC's measles vaccination recommendations for international travel. I was on there's a link, measles cases and outbreaks, measles, rubiola, CDC, on the nursing report, if anybody wants to know more about the actual cases and the outbreaks. But I was on a call yesterday and they were saying, they confirmed this measles vaccination and travel information, and that there was a Turkish airline flight where, this was in the last few days, where 4 people were affected by someone having measles. 3 of those 4 were actually vaccinated adults. So it's quite dangerous. So, bird flu. So at this point in time, there are still 70 people, 70 human cases that have been infected. 1 person has died from the virus. That hasn't changed yet. That's been like that for the last few months. The animal spread, the virus has affected over 1,000 dairy cattle herds across 17 states. It has also been detected in wild birds, poultry, even mammals like cats and seals. So there was a vaccine development. The US government just recently canceled over $700 million funding for Moderna was coming up with a bird flu vaccine. So there were safety concerns. So that project has now ended, and hopefully they will regroup, figure out what's going on, and move forward with that in the future. Surveillance and prevention, the CDC is still closely monitoring the situation and has confirmed still no sustained human-to-human transmission has occurred. And of course, they keep warning that this virus could mutate. So, and more information on that, there's a link there on cdc.gov, bird flu situation summary index. That'll be in the report as well. Just, some precautions regarding bird flu. Maintaining good hygiene, keeping vaccinations up to date, being aware of your surroundings. And vaccinations up to date means your health status in general. And also, if there's a dead bird on someone's personal property, they are responsible for disposing of it and wear protective equipment such as a mask and gloves to handle it. If there's a dead bird in the public way, so like a common sidewalk or something like that, animal control would pick that up. They would have to be called, okay? Also, if there are 5 or more birds in one location, they should report that online, and there's a link for that. There's a mass.gov forms report observations of dead wild birds link on this report, and that should go out to the public. In terms of livestock and poultry, since wild migratory birds are natural carriers for bird flu, preventing wild birds from mixing with or having contact with domestic flocks is essential to disease control and prevention. So there's also more information on that. Another link, avian flu at mass.gov. Okay. So just a travel health precaution. This is in terms of global outbreaks. There are outbreaks of chikungunya, and this virus is spread by mosquitoes. And the condition is called chikungunya. There is also another international virus circulating, the polio virus. So the take home from all this is to stay updated with your vaccines, and especially your polio vaccine. And also check online for travel notices if you travel, on what vaccines are important and what areas of the country, the world, are having what level type outbreaks. So this is June, and June typically starts the mosquito surveilling season. And so the season goes from June to the first hard-killing frost, usually October, sometime in October. So I'm just going to go over with you what this means for the Board of Health, what the process is. So because this information isn't out yet, I think, on the mass.gov site, but this is from 2024, from Mass DPH. So the Arborvirus Surveillance and Response Plan, which is what this all falls under, provides surveillance and phased response guidance for arthropod-borne viruses, arborviruses, affecting Massachusetts residents, which what they normally track for the most is equine, Eastern equine encephalitis virus and West Nile virus. Those are in particular. So what we do is local boards of health are asked to provide routine and emergency contact information for primary and secondary arborvirus contacts during the season. So for Shrewsbury, I'm the arborvirus contact. I get the reports from the state, summarize them, and then disperse them out to the towns in our jurisdiction. Secondary contact would be considered our health director, Tamara Lundy in this case. So we are referred to as the arborvirus coordinators, and they're the Department of Public Health's first and primary point of contact with regard to arborvirus season information. So communication to local boards of health occurs through multiple mechanisms. Routine communications and initial communications about any findings primarily occur through the HAN network to the identified arborvirus coordinators. Important summary communications, such as weekly reports, that's what I receive, are also sent through the DPH Office of Local and Regional Health. I get that from them. Urgent communications impacting multiple municipalities are sent through the HAN to arborvirus coordinators and the Office of Local and Regional Health listserv. So this is, it's real time, and then we respond with do we need spraying in those areas? So then we get on board with the Central Mass Mosquito Control Project, which is the next topic, the CMMCP for short, is a regional program in Massachusetts. It's focused on mosquito control and public health. So it provides larval control, adult mosquito spraying, ditch maintenance, and surveillance. This is to reduce the mosquito populations and prevent the spread of diseases. So they also offer public education on mosquito prevention and allows residents to request mosquito spraying or opt out of pesticide applications. So when you find out your area is being sprayed, you can go on their website and opt out. So and it's a very interesting website that I think everyone should be familiar with. So as we know, mosquitoes thrive in warm, humid conditions, and prevention methods always include using insect repellent, eliminating standing water, wearing protective clothing when outdoors to reduce exposure. And the 2025 spray season is scheduled to begin June 2nd, weather permitting. And requests to spray, like you can make a request to spray at the Central Mass Mosquito Control Project, which is a link online. And I think that's the end of that report. But all this information I add to the weekly arborvirus reports when I send out and say, hey, they found, these species in these counties, but here's what all this means. So the reports will start coming soon as I get the first one.
Great, thank you.
Thank you.
Ms. Watson? Go ahead. Ms.
Oh,
Watson.
sorry. Good morning. So it's been a short time since we last met, but we've conducted 25 inspections, primarily pools and mobile food vendors and temporary events. We're still working to stay on top of all of our routine inspections, but we did have two new establishments pass their pre-operational inspections, one being Big Apple over on Maple Ave. They, I believe, are open for business. And then BB.Q Chicken is the name of the other one on Boston Turnpike that passed, and they are scheduling to open within the next week or so. We did have one food complaint at Price Chopper. There were heads of lettuce that apparently had bugs in them. It was unfounded at the time of the inspection, but it's just a good time to reiterate the importance of washing produce before consumption. And we also did 3 health plan reviews for new establishments that are coming. So those are all set, just waiting for pre-operational inspections.
Great, thank you. Questions for Ms. Stefanski?
No, no questions.
Excellent. Ms. Walker, any questions for Ms. Stefanski or Ms. Houghton?
No questions on my end. Thank you both very much.
Great. This is probably the last time that we are convening as a current construct of the Board of Health in Shrewsbury. As we heard from our town manager last month, that there might be a change in the construct of the board starting next month. So I want to take a moment to acknowledge the exquisitely hard work that Ms. Amelia Houghton and Ms. Emma Stefanski do, for all the expertise they provide and for the diligence and for being here month after month to not only make reports but also to follow up on issues as they arise. And so I want to place on record the fact that we're extremely grateful to both of you for all your services to the board thus far. So thank you very much.
Yeah, thank you. We're going to miss
It's
working
been a
with them.
pleasure.
Yes.
Thank you.
Likewise. All right, our next meeting, I believe, is scheduled for July 23rd at 8 a.m. or immediately after the public hearing.
Mm-hmm.
All right, with that, I'll take a motion to adjourn this meeting.
Yep, make a motion to adjourn.
All right, Ms. Walker, do you want to second it?
that motion. Second that motion.
All right, well, we'll take a motion. Ms. Rosace,
Aye.
Ms. Walker,
Aye.
Abraham votes aye. The meeting is adjourned. Thank you very much.
Thank you.
Thank you all. Take care.